Neha from Indus Action, and I'm really grateful to be a part of this platform today. I'm really excited to talk to you guys. Um, Before I start talking about the work that we've done post COVID, I briefly want to talk about what Indus Action does. Indus Action is a nonprofit that works on policy implementation. And before COVID, we were primarily working on the implementation of Right to Education Section 12(1)(c), which states that 25% of the seats in a private school are reserved for the economically and the socially disadvantaged sections of the society. Apart from that, we were also working on Pradhan Mantri Matru Vandana Yojana, um, which comes under the Right to Food Security Act, under which a pregnant and a lactating mother received maternity entitlements up to 5,000 rupees. So we're working on various states ensuring that families had access to these entitlements. But as COVID hit, most of our operations came to a standstill because schools shut down and Anganwadis shut down as well. Things on ground, there was like really limited and absolute no activity on the ground, especially during the lockdown, which got us thinking that what do we do to ensure that the families that we've already reached out to in the past are doing well, are safe. And the government had announced various welfare entitlements during the lockdown, so we also wanted to ensure that the families had access to those welfare benefits, and at the same time had enough food to keep them going as well, had resources to keep them going during the lockdown. So while thinking around this, we realized that we do have a lot of families, a lot of contact details in our database. Ideally, Intersection would have conducted on-ground campaigns, awareness campaigns through our community champions on the ground, spreading the word, supporting them with the application process, ensuring that they get these entitlements. But due to COVID, that of course couldn't happen. And we resorted to phone calls then. So we reached out to these families through phone. We called these families to ensure that they had access to food, they had access to health facilities if required. And apart from that, we also told them that the government was giving them various benefits. Be it in direct transfers into the Jan Dhan account, or benefits under PM Kisan Yojana, Ujjwala Yojana, etc. So we wanted to ensure that the families had access to these benefits as well, or even were aware of these benefits as well. So we started doing these phone calls, and initially it just started off with us as the team who made these calls to different families uh, to ensure all these pieces. But we realized that we needed a proper system in place where we could capture all this data, so it could later be analyzed, and families that needed immediate support could be flagged. Also, a lot of members on a team had concerns with their phone numbers going out into the community as well. Um, to take care of the calling piece and have a space where all the information that was coming in could be recorded in a smooth manner, so that data could be analyzed effectively later, we designed the rapid survey tool. A calling It was a mixture of a calling and a data entry tool. It was a product that was designed by the tech team of Intersaction, using open source platforms that were available. What we did was we integrated a calling tool with a survey form. So every time a caller would reach out to a community stakeholder, somebody who was in need, they could capture in their responses, so that next time when a repeat call was going on to them, the previous information was already with us. And the backend team would be able to analyze data easily on a daily basis to flag in and look into families that needed immediate support. And then through our team of volunteers, we ensured that that they receive and support as soon as possible, be it with respect to food or health as well. So this was pretty challenging for us because given that most of our operations were usually happening on ground on a face-to-face basis, we usually would conduct a lot of door-to-door campaigns for awareness and ensuring access to entitlements. Switching purely to a phone-based support was something that we did. Um, was very different for us, and but we did initially it was hard to convince everybody on the team as well, because we often felt that the connection that was probably made through door-to-door campaigns and home visits, those relationships couldn't be established over phone. But we were proven wrong over time, and we were able to support thousands of families with access to food and health benefits during the lockdown. Um, Another key thing I feel like that was important for us during this was just ensuring that we have the right tool in place to one is allocate. And initially, we it was all a manual process. We would allocate in calls to all our team members. They would make in those calls. They would capture in those information on Google Sheets, and then on WhatsApp, they would flag in numbers. Like we had a group where they would flag in numbers of families that needed immediate support. So there was a lot of human intervention that went in over there. And the process wasn't streamlined. A lot of information was getting lost. A lot of security concerns were coming in as well. So with the rapid survey tool being designed, a lot of our problems were taken care of. Things like call allocation became automated. The data was being collected in a very smooth way, so that escalations became really easy. Follow ups became really easy. So the tool is has been like really helpful, and we still continue using that tool for different outreach or support campaigns that Indus Action conducts. Another key thing that happened just as unlocking started happening was schools were specific to Delhi, that the admission windows opened up again, and children whose name had come in under the lottery were going to get admitted into private schools. So while it was a great thing, but we weren't prepared to take in a load of thousands of kids that had already got admitted under 12(1)(c). One, to let them know that they've secured admission, and to take in the grievances and to support them in solving those grievances as well. So to streamline the grievances that were coming in, ideally we run a helpline where from the month of October to July or August we see a heavy inflow of calls, and the helpline then supports in parents through nudge calls, ensuring that they go to school to securing their admission, and also supports them with registering grievances or solving for grievances as well. But given that this was a very short window and a very short time period, so we had to figure out the best effective way to support families with nudge calls, support them with solving grievances as well. And so for this time, what we did differently was we did a mix of IVRS calls, helpline, and we deployed a chatbot as well, because last year we realized that over 80% of the families that we reach out to have access to WhatsApp. So we did figure out a flow where the initial nudge was made through IVRS calls, and we deployed a chatbot where the grievances could be streamlined. So the initial level of grievances with respect to letting a family know whether they've gotten through school or not, or the documents that were required, or the process to be adopted. So those initial level of grievances or challenges were handled by the chatbot itself, and only the secondary level of grievances where the schools were denying admission, or there was a wrong allocation that had happened, only those calls were then directed to our helpline. So this in turn helped us ensuring that there's not a lot of load on the helpline, and given that it's a short window, and like multiple things need to be catered to, so through IVRS, the chatbot, and the helpline, we were able to ensure, and at least the families were aware that they had like the admissions had opened up and they could go to school, get their seats secured. And if there were cases where schools were denying admission, they could definitely come back and register grievances, where we, along with DCBCR, would support them in ensuring that the child gets admitted into a school that they've selected and they've got through the lottery. Post COVID, this is a rapid survey tool and the chatbot have been of tremendous help to us, and deploying both of them through help from various other nonprofits in the ecosystem has been really empowering, and not just for the internal team's confidence that we could develop in products that would help us streamline operations. But I think this is the first time where the ops and the tech team sat together, brainstormed on multiple solutions, and then figured out a common win-win, which was operationally feasible, something that could be easily adopted by everybody on the team, and at the same time useful enough to reach out to our beneficiaries and provide them with the right type of support. I'd be happy to talk about the chatbot and the RST more in detail. The rapid survey tool that we've created is an open source product. So if any other organization would be interested, we'd be definitely happy to share in more details around it. Yeah, happy to hear your thoughts and to take in questions, if any. Thank you.